is your position on healthcare?
Okay, my position on healthcare is pretty simple. I believe that the best system for the United States would be a universal healthcare system, whether that's through single payer, mandatory, or a two-tier system. I just think that would be the best for the American people.
My position on healthcare is that I don't think that the universal healthcare system would work in any way. I think that they have inherent problems, and I think we should trust in small-scale democracy at the state and county-wide level through free market incentives to ensure everyone is medically insured.
Is healthcare a right?
So simple answer is no, I don't think that healthcare is a right. Although everybody should be insured and everyone should be allowed care, I don't think that you could call healthcare a right for the simple reason that it is a service. So if doctors suddenly have lost incentives for becoming doctors, and we call healthcare a right, but we have no doctors, what are we to do? Are we to force people to be doctors? In countries such as Venezuela, which have actually called healthcare right in their constitution, you can see how bad things are in Venezuela, how virtually no one is really cared for health problems. I think that we need to, yes, not deny anyone care, but we can't call it a right because ultimately it is all up to the freedom of the private insurance companies, whether they are going to insure you or not.
I disagree. I think that healthcare should be a right. Just because something's a service, I don't believe it can also be a right. For example, I think that like police protection and protection by firefighters are a service, but I don't think either of us would argue that that's not a right that everyone should have in the country. Also, there are several things written in the Constitution, such as a right to a speedy trial, which is also a service, which I think we both agree is a right. And when you talk about Venezuela, sure, there are countries that have written it to their constitution, and in Venezuela's case, it doesn't work out. But you can call healthcare a right and not have it be written in its constitution. That doesn't necessarily mean it's not going to work out. For example, in many European countries, healthcare is considered a right, and it's very arguable that their system is way better than ours. So.
Well, I would argue that no, the European countries where they've called healthcare right is not better, like in places such as Canada, and as I already said, Venezuela, but even, Canada and European countries such as France, wait times are way higher. And I think there's a lot of problems with universal healthcare in those countries. I don't think this is a question I think it's really just a logical argument. You can't make a service a right. It's as simple as that.
But we have amendments that are services that we give people the right to have.
And they shouldn't be rights. They should be services.
I disagree.
Okay.
What is wrong with our healthcare system right now?
Okay, I think we can easily find some common ground here. I definitely think the United States healthcare system is definitely not the best. In fact, far from it. Definitely many problems. For one, a lot of people in America are uninsured, and I think we can both agree that that's a problem. About 60% of people do not have health insurance.
Something like that.
We also pay the most per capita in the world for health insurance. We pay about $9,000 per capita for health insurance, which is way more than any European countries, double of some European countries, in fact, which I think is wrong. So the fact that we have less coverage than other countries, yet we pay more, just doesn't add up to me.
Okay. So there's a lot of problems with yes, I think we would agree that the healthcare system in the United States is not the best, and it can be fixed. I think that's common ground that we can both find. I think that a lot of problems with the healthcare system right now are the prices, obviously, but I think that it's more because of federal regulation. We pay 8% administration costs, which are federally regulated, opposed to like 1 to 3% in other countries which have socialized medicine. I think that's a big problem. Another big problem with the United States is there's a lot of medical fraud going on. Doctors are losing their incentives to be doctors, and this has to be attacked. We have to fix this medical fraud issue, and there's a shortage of physicians in the United States, and I think that is a big problem with the healthcare system right now.
Yes, we can both agree that there are definitely problems with the system. However, I think that the administrative costs could definitely be eliminated with the universal healthcare system. If we go to a universal healthcare system, such as like a 2-tier, those administrative costs would be eliminated because we wouldn't have to deal with these private insurers necessarily. We could just deal with the federal government, which would cut those costs for sure. So.
Okay. Well, I think that is just I don't think that that's a correct claim. I mean, Canada, which I believe is a socialized medicine country, it has increases in it's by 39.7 billion to 137.3 billion dollars when they made their change. Wait times are up by 95%. I don't think that the universal health care or any kind of universal health care will actually help the United States.
How would we pay for universal health care?
So how are we going to pay for universal health care? That's a doozy. I don't think we can, and I think that if we try, it'll cost so much money. For a single payer system, if we implemented it into the United States right now, we would add $32 trillion over 10 years into the national debt. And if we really want to think about this, we have $22 trillion of national debt, and we haven't been debt free since 1835. I think that is an egregious I think that universal health care would be an egregious attempt on the United States' freedom, and I think that it would cost way too much money.
Luckily for you and me, there are more than one type of universal health care. I do agree with you that single-payer system definitely is not the best system of healthcare. As we've seen in Canada, the wait times are crazy and such. However, I do believe that model you referred to only takes into account single-payer, and there are other systems such as two-tier. The thing is, even though America is not completely covered, as you said, I think we both said only about 60% of people aren't covered. We still pay a lot in taxes. So although the taxes might go up higher, and you're true, it might be a little bit more money, I still think for how much we pay, it's not going to be that much of a difference, and also I think it's worth it to have more people covered.
Well, I think that your premise that the taxes will be a little higher is a bit of an understatement. I think it'll be quite higher, and actually, in the countries that have implemented single-payer or two-tier, they tax cigarettes, booze, sales tax, and gas. Mm-hmm. But the cigarettes and booze tax actually hurts the poor more than the wealthy. The poor aren't buying as much of these things the poor are buying more of these things than the wealthy. I think that that we shouldn't try to socialize our medicine. What we should do is we should, attack this thing called the Iron Triangle, the insurance companies, the Congress, and the lobbyists. We need to make it so that their special interests are denied so that we can federally regulate the economy based off of free market incentives. And I think that is how our country will lower the costs.
I do agree that we need to tackle the Iron Triangle, but I think universal healthcare is an excellent way to do so. Like you mentioned, in European countries, they tax things such as cigarettes and alcohol, which you stated that hurts the poor people because they purchase more of those things. That might be true, but I also might think there might be some benefits to taxing some of those items. One, it helps pay for universal health care, which helps keep the country more healthy, and also taxing some of those things might make people think before they buy those things, which I think is better for a country. So,
how would healthcare on a state or county level work?
I think that this question give me an opportunity to explain my position on healthcare a little bit more clearly. I think that we should trust in small-scale democracy at the state and county level, and we should allow the block grants and local Medicaid dollars and stuff from the government, right? Because I am for federal regulation to an extent that it helps the people. And then with these block grants, with this money that the federal government gives the states and even the counties, we can focus more on fixing healthcare for the individual and for the smaller collective than the whole, 323 million people in the United States. I think also what we need to do is, with our HSA, with our health savings account, sorry if you don't know what that stands for, health savings account, we should focus on primary care, because this is the door to a healthy lifestyle, not just for symptom relieving, but even for just having a healthy lifestyle. And so the doctors would actually run their own practice, and it wouldn't be free, but it would be cheap membership, and we could focus on the individual.
I disagree. I think that healthcare on a state or even county level would not work. I personally believe especially at a county level, there's absolutely not the organization needed to give the American citizens the health care, which is an extremely important thing to provide the people. I think the federal government is more organized and has the capability to provide health insurance way more than a state or county level could ever do. We see it in many other countries, such as France, Singapore, Germany. All of them have federally run healthcare systems, and they all work great. Obviously, there are downsides, such as longer wait times, but I believe as a whole, there are way more benefits to these healthcare systems that are all run on a federally based level. I don't understand how that could work with the lack of organization that we see from county to county. So,
Yeah, and I hear what you're saying, right? There are benefits to a universal healthcare system. I don't deny that, and I think that if it is democratically brought into the United States, I think that let's see what happens. I don't think it would work, but let's see what happens. But for what I think, we should reform incrementally based off of the federal government. But we're only going to use the federal government to make sure that the individual is safe, the individual is healthy. And I think that trusting in democracy small scale will work better than trusting in a federal government, which has been proved not to work many times.
I think it's quite the opposite. It's been proved. It's been proved to work many times. We see it in other countries that are run federally. I think, as I've said, the lack of organization from county to county would not allow this interesting system to work. I think federal governments are the way to go on that. And as you mentioned, we want people to be healthy and live great lives. 100% agree there. And I think a federally run universal healthcare system is the way to go. With a universal healthcare system, such as a mandated system we see in Germany, or a two-tier system as we've seen in France and Singapore, everyone pays for a basic level of coverage through taxes, so everyone's covered, so everyone's going to live a happy and healthy life. And although those wait times, as you've mentioned, are higher, sure, the United States obviously has very good wait times compared to other countries. I think having a little higher wait times is a price to pay for having everyone in your country covered, which I think is a right.
If a universal healthcare system was implemented, how would you get people to become and stay doctors?
I definitely think this is a very good question. I think one of the greatest problems with universal healthcare, as people have proposed, is that you have trouble incentivizing doctors to stay because the pay is not as good as it is in other countries, especially in the United States. Unfortunately, I do think if we switch to a universal healthcare system, the doctors are going to have to get paid a little less. However, I do think there are many ways we can get the doctors to stay doctors and even get new people to become doctors. So as we see in other countries that have embraced the universal healthcare system, such as France, the way that they keep their doctors is that they pay for their insurance and education. So basically, if you want to become a doctor, the government will help you do that. And although definitely in Germany, as you mentioned, doctors do not get paid as much, they still get paid more than any other profession in that country. So.
Okay, and that's fine. You can say that, but I just think that is a good example that German doctors are complaining about how they don't have incentives to be doctors because they're not paid as well as they should be, mostly based upon federal regulation, because since it's so federally regulated, it kind of takes away from their paycheck and it hurts them. According to the National Review, if a Medicare for All system would be implemented to the United States, the shortage of doctors, which is already present in the United States, will just continue to go down. And I don't think that if we socialize our medicine or we make universal healthcare like a right or whatever, I don't think that this will actually help the doctors and incentivize the doctors. Because doctors don't like being forced to be doctors, I can tell you that much. So, yeah.
Yeah, I agree. Doctors don't like being forced to be doctors, but luckily there are other ways to do so. Sure, there are complaints in Germany, and I'm sure there's complaints in many other countries. There's also complaints here in the United States that we don't have great healthcare. We have to pay crazy amounts to just get a basic drug to make us feel better. And I do agree, sure, the wages for doctors will go down, but I think that's a price we have to pay. And to compensate for that, there are ways the federal government can keep doctors and incentivize them to stay doctors. Just like I said, if we pay for their education and help with their insurance prices, they'll be able to stay doctors. And if what it takes to provide America the coverage it deserves is perhaps doctors to not make as much money. I think that's a downside and a price we have to pay in order to benefit the majority of the American population. And just to clarify, doctors will still get paid a very decent amount of money. It just won't be as much as they do now, which is plenty.
If you could change one thing about healthcare, what would it be?
So I believe that there are issues with the universal healthcare system, such as higher wait times, way high projected costs, and not very many incentives to become doctors. I think that if we want to incentivize doctors, we want to incentivize the medical field, we need to free up the market, we need to attack that iron triangle, and we need to federally regulate based off of free market incentives and have small-scale democracy like the state and counties, which can really account for the individual.
I agree. There are going to be higher wait times for sure, but I don't agree or appreciate you citing that one study, which I agree is higher prices, but that's only based on a single-payer system. There are more ways to provide people with the coverage they deserve than a single-payer system. As I've mentioned, in France, which has a two-tier system, they also find ways to incentivize their doctors through free education and free insurance. There are many ways to get people the coverage they deserve that involve universal health care. As we've mentioned, the United States healthcare system is not good. We have 60% of people that do not have healthcare coverage. That is millions of Americans. We pay far more per capita than any other country in the world for healthcare. And all of this to have millions of people uninsured. I think to fix this, simply move to a universal healthcare system where everyone has to pay for a basic level of coverage that can get every American the basic coverage they deserve.
I'm Dimitri Vuyadinov.
I'm Grant Preves.
It's been a pleasure, Dimitri. Nice job. Pleasure, Grant. Thank you for watching.